As you all sit here tonight, keep in mind that each of you have taken the first step. All of you have voluntarily accepted the responsibility of patient care for people with scleroderma. After tonight, you will be educated.
On November 4th, 2019, the third Interprofessional education event, Focus on Scleroderma, was held at the Albany College of Pharmacy and Health Sciences. The event is a collaborative partnership effort involving the Steffens Scleroderma Research Foundation, the Scleroderma Center at Albany Medical College, Sage Colleges of Health Sciences, and Albany College of Pharmacy and Health Sciences. The purpose is to introduce graduate-level students in a variety of disciplines to scleroderma by having them interact with patients and with one another. Guided by experts in their fields, the students learn the impact of scleroderma on patients. Participating in this event were candidates in nursing, nutrition, occupational therapy, pharmacology, physical therapy, and psychology. To help us measure the impact of this event, we interviewed several students before the program.
I was not aware of what scleroderma actually was. I had heard the diagnosis, but I don't know really what it had entailed.
Thank you.
I had never heard of scleroderma before this event, but I'm glad to be here to learn more about it.
I was not aware, but I'm very interested in learning more.
Peter Meenan of the Steffens Scleroderma Research Foundation and their Chief Medical Officer, Dr. Lee Shapiro, stressed the importance of the IPE.
As a foundation, we have three primary goals. Promote research towards the treatment and cure of scleroderma, Dagos, and related disorders. Promote awareness and understanding of these disorders, especially among healthcare professionals.
Scleroderma is a disease we don't recognize quickly enough, nor one for which we do enough. Our mission is to make sure you as healthcare providers know of scleroderma, know of it so that no patient is greeted with a blank stare when meeting you and mentioning their diagnosis. Instead, maybe you will be the first one to recognize its features and the first to suggest the diagnosis.
Patient advocate Amy Gaytan was the keynote speaker. Amy was diagnosed at the age of 19 and has lived with scleroderma for 18 years.
When we think of this disease, we automatically think of the skin, probably because the name of the disease has skin in it. We tend to overlook just how intricate and complicated this disease really is. Not only to diagnose and treat, but to manage and to live with daily.
Heather Friends is the Director of Simulated Education at the Albany Medical College and is also a scleroderma patient.
So I encourage you to ask a lot of open-ended questions, and open-ended questions allows a patient to really tell their story, whereas a closed question asks for like a yes or no response. Really let your patients tell their story. But once they've told you something, follow up on that information so they know that you're listening and that you can carry that thread.
After her remarks, students had the opportunity to interview patients at each table.
What is my diet like? That's probably been more affected. I cannot eat the volume that I used to eat. My digestion is so slow that for me to try to lose any weight is very, very hard. Like I have to go under 1,200 calories to try to lose weight, just because it just does not empty ever.
How do you feel that your life or your role as a husband has changed since your diagnosis?
But for me, it just has more to do with the unknown of, could she be around 5 years from now or 25 years from now? Because it only takes one complication to really take her life. So that's how it's affected me psychologically so much.
The next phase of the program consisted of a panel discussion among the experts, with each participant fielding questions from the students.
I literally had a woman say the other day to me, I said, "It looks like you're doing pretty well. Your hands look like they're not terribly involved." She goes, "Oh, I'm so relieved. I thought this was a death sentence." And, do not underestimate the power of your words, and do not underestimate the power of your attitude in bringing hope and also a positive frame of mind to the person that you've been entrusted to work with. And they will teach you.
The last portion of the program was conducting of a simulated interview with Amy. Students posed questions on how they could help patients from the perspective of their own specialty and how they might interact as a team.
I'm here to evaluate your movement system. So I heard your occupational therapist talk about you said to her some of the activities that you were having trouble with. Well, my job is to evaluate the way you're moving and to see what factors are limiting that movement. So it could be weakness, it could be stiffness, it could be pain, and see how those individual factors collectively are preventing you from doing what you want to do.
After the program, we again spoke to students, as well as patients, to get their comments and input on how the program might be improved.
I think just hearing all of the individual stories from every patient and how it is truly different for everyone and how we as professionals can help them through that experience and maybe lead them to a diagnosis they may not have previously received because of this experience.
For me, I would say the most important aspect was to get that interaction with the patients and more than one patient at that. You know, you can read about this sort of thing in a book, you can get a lecture on it in class, but to actually hear firsthand experiences, to see the differences, to see the similarities, that to me is what really brings like what I should learn for the future and maybe identifying this in my own practice.
I think from talking to the individual patients that I talk to, it makes me more empathetic to the problems that they may have, and to know that it's very individualized, that the two patients that I did speak to, they both had very different problems, and to be aware of how encompassing it can be and how it can affect a different body part for each individual patient. And it made me more aware of that.
Well, they had many great questions, and the more people that know what scleroderma is, maybe we can find some kind of comfort for the patients like me.
And do you have any suggestions for making this event even more valuable?
Just more awareness and trying to get more people here. Maybe someday we can get one of the news feeds here for this.
Thank you.
You're very welcome.